Hi everyone, I'm Dr. Lin of Rehab and Revive Physical Therapy here in Tustin, California. We have another Stephanie who's going to help us with this segment, but it's a new thing. We're going to talk about the knee series and understanding your pain a little bit better, how to identify it. We have a little quick test I learned from my mentor, Greg Johnson of the Institute of Physical Art. He teaches this and helps us identify a little bit some of the drivers of bad mechanics at the knee. And so let's go ahead and zoom down at her knee. So let's take a look at the mini squat. And this is a great way from my mentor, Greg Johnson, the Institute of Physical Art, as she continues to do this. You want the middle of your kneecap. That's where you eyeball it from bird's eye view. It should track between the first and second toe. And it should be nice and smooth, no deviations, no rotations, and no buckling. If it's early on in the range, if it's going to collapse or it's going to rotate early on, and that's the hip that usually drives it. If it collapses a little bit later as she bends, it's probably the ankle that drives it. So if it collapses in, collapses out at the end of the range. And that's what helps us drive us the source, because really it's a hinge joint that is, has two different ends, the hip and the ankle. There you go. And then if you look over here, it's a little different. She's putting less weight on the side, and it comes out towards me in this angle, towards me a little bit more, and then it kind of corrects itself. So I always think Stephanie's hip is the driver of this. There you go. And you can see, she's also doing great job being intrinsically using her foot muscles here, and you can tell she's barely using any foot muscles there. So those are great indications that we want to take a look at in future videos, and then understand what is driving this pain. So there you have it. We had Stephanie there to help us. I think this is a great way to help identify and see what may be driving the knee pain, the hip or the ankle, and then we got some new interesting videos coming ahead. We have some rehab exercises. We have some postural and more habit things that may drive also this pain, and just anatomy. I think that's great to know when you understand that a little bit better. So stay tuned. If you're new to our channel, please like us, subscribe, and leave a comment below. We have Stephanie, and I'm Dr. Lin of Rehab and Revive. Thanks again, and we'll see you again. We can and we will get better together.